So our Congress and the House, Republicans and Democrats, they should really decide who they want to serve. They either want to serve the UN and the WHO and the Integrative Policy Health Organization or Policy Organization, and I have more to show about them, or they want to serve their constituents, but they can't do both. They can't, because unfortunately the very people they have been serving, like the Integrative Health Policy Consortium, is too aligned with the World Health Organization. Yeah, so doing that has proven that it's made our healthcare system worse. Nurses and doctors didn't used to be under all this nonsense. It was so much better outcomes, better teamwork, better everything before they brought in their integrative bullshit. What integrative they're trying to do is that we have to be aligned with all the governments of the world and the World Health Organization. I really wish these socialists, I don't care if you're doctors or nurses, there's so many countries you could go live in and be your socialist self. Why did you have to destroy healthcare here? And I may be the only nurse, likely I am, the only nurse in America that's saying it, but I'll say it loudly. And you can keep silencing me and you can keep taking channels down, but I don't give up. I don't. So this is from the Integrative Health Policy Consortium. Why is public policy the solution? Well, let's first say it's not. Public policy is part of the solution. It is the part that the Integrative Health Policy Consortium attends to. Yeah, but we didn't elect you to anything. For patient-centered, prevention-oriented healthcare to flourish. This is all gobbledygook. So let's just go to the highlighted part, because that's what health professionals are really good at, is writing stuff. That's what the higher education did, to make it sound like, oh, they know what they're talking about, and it's just all, ugh, it means nothing. But down to the highlighted part. Must be fundamentally redesigned. Today's healthcare system must be fundamentally redesigned. That just reminds me of Barack Obama and his America must be fundamentally changed. It is true that activity in the private sector has recently produced measurable benefits in fostering health promotion and disease prevention. However, these incremental shifts remain on the periphery of a much larger dialogue on U.S. healthcare that needs to be completely redirected. Oh, no. Where you people are leading it is going down the toilet. But see, they go to Congress and get all this money, and then who they serve is the World Health Organization. This was 2023. It was the Integrative Health Policy Consortium's outlines key congressional funding measures for 2023. They don't even know how to prioritize right. Nothing about trafficking, even though that's the pandemic, but they don't want to focus on that because the World Health Organization doesn't want to focus on that. I mean, really, who they've aligned with is quite disgraceful. And as you can see here, they issued a letter to let's just read it. Issued by Tracy Bowen, Executive Director of the IHPC, and Margaret Erickson, the 25 letters after their name. Okay, we can skip over that. And Chief Executive Officer of the American Holistic Nurses Credentialing Corporation. See, I told you, they're all just, it's the same diseased system. The letter called for President Biden's administration to appoint individuals, especially within the Health and Human Services, who are experts in the programs and policies that they will be responsible for managing, who understand and appreciate the mission of each HHS agency and are committed to strengthening these agencies. So more control. The organization also said it supports the appointment of senior officials at the Department of Veterans Affairs. That my stomach turns when I read it. I don't even like these people being near the veteran system at all. I don't, because they're just not, they don't know how to do the right thing. They're immoral. who will continue and enhance the department's provisions of integrative health care services to veterans. That's the worst thing for but everybody who's been running the veterans, the VA systems for so long, they've always been a disaster. So yeah, that's why we need to get rid of the swamp. And their whole health program commitment retained and funded. But see, they go back to the Integrative Health Group makes global declaration. Yeah, there was a declaration in 2016 at a conference in Germany promoting the integrative health medicine. So they're loyal to the World Health Organization. They're not, that's why they trample all over our Constitution and just make all these demands. That's why the people, whether they're Republicans or Democrats, they really need to decide what they want to serve. Because as long as they're going to serve the IHPC, then they're serving the UN and they're not serving the American people. But I'm going to jump further down in this. Because they want all governments, action from the governments, the WHO, and professional organizations to promote use of the integrative model to manage global health issues. So ridiculous. The declaration has been posted here at change.org. Oh, does anybody know what change.org is? Blue, blue, blue. And has over 1,000 supporters at the time of this writing. Well, 1,000 misguided, morally bankrupt in some cases, supporters. Work on the declaration began inside the AIHM. Leadership in the organization's plan to go global with their mission has been led by longtime integrative medicine leader David Riley, MD, and Tabitha Parker. Yeah, misguided fools, but socialists. So that's why they're misguided and morally bankrupt. And I know I'm jumping around this. It's because all of this is ridiculous. This is all. It is not the government's job to do all this. For those that don't realize, we live under socialism. So every step they take more into this is taking us into the globalist system, communism. They already have us living under socialism, which is why you don't recognize your Constitution. Because, look, this is all about getting funding so that, and they're telling the people you elected who they have to hire, senior officials they know that will do their bidding, and where the funding goes to. So this is why healthcare continues to get worse, is because when you have socialists controlling it, it will go in the toilet. I mean, it's shown in history. Everything will. Consultation with other federal agencies to develop and implement a federal strategy to reduce nutrition-related chronic diseases and food insecurity and improve health and racial equity in the U.S. Okay, right there, totally morally bankrupt. Totally disregard the pandemic of trafficking, okay? Because they supported open borders. Because you have to align with open borders to be on board with the World Health Organization. So right there, morally bankrupt. Never once admit to any of the trafficking of children or young women. And I know it. I absolutely know it. And it's what Trump was eradicating. So how can't the experts of health, the holistic experts too, not know that? Because they're socialists. And socialists are stupid. Really, they are. I'm not trying to be mean. They just are stupid. They have a ton of education. Too much education, I would say, and it made them stupid because they became socialists. This isn't the government's job to do all this. That's not what our government was created for. I'm not saying that there shouldn't be some safety guards here, but what these people want is total control. They want so much control that they want to totally do a change to our healthcare system, and they won't make it better. Because these are the same people that made it worse to begin with. They'll take it into globalized health, which is communist health care globally. Our people that are elected need to decide who they're going to serve, the U.S. or the UN, because we know who these assholes serve.